So I found a research paper submitted to the Institute of Medicine in Washington, D.C., all the way back in 1986, and it's by Dan Brock and Alan Buchanan, and it's called Ethical Issues in For-Profit Healthcare. And there's a particular passage within it that I feel perfectly demonstrates how for-profit healthcare is dangerous even in concept, and how healthcare should not be considered a business at all, because the profit motive is the first step towards creating a caste system within healthcare, or creating a tiered model based on how much you can pay. And it's a slippery slope of determining who gets what level of care, and who's worth what level of care. And that starts with a for-profit doing what the article calls skimming the cream. I really like that analogy. I know it sounds a little racy. But for-profits skim the cream. First, they capture the most attractive segment of the patient population by locating in more affluent areas, meaning they move to where more rich people are who can pay more for their services. And that leaves nonprofits with a correspondingly smaller portion of paying patients from which to subsidize care for non-paying patients. So the nonprofits have to move to more poor areas where people can't pay for their care and they can't subsidize as much of it. It's pretty simple and straightforward. And by concentrating those services that generate higher revenues relative to the cost of supplying them, they can achieve greater revenue surpluses, meaning they can choose which services to provide, and they can choose the services that they can charge the most for the least amount of material and labor. And I have a funny personal story on that. I can give a very funny personal example on that. That one time I was washing the dishes, and we didn't have a dishwasher, so I had to do them by hand. And I broke a glass in the sink, and it was so clean that it cut my index finger, and it was gushing. Like, I couldn't stop it, no matter how much pressure I put on it. So it's like, oh, it's going to need stitches. So I go to a Yale urgent care, and I think I sat there for 10 or 15 minutes, and then a guy called me into a little room, and he put a liquid stitch on it. You know, he sterilized it, and then put a liquid stitch over the wound. And I think I pled poverty. I didn't have insurance at the time, and I was between jobs. And so they were like, well, you'll get a bill. And sure enough, I get a bill for $2,300 for services rendered for that single liquid stitch, because I cut my finger, doing the dishes. And so that's exactly what they're talking about, that if in a for-profit model, they can choose to charge $2,300 for a liquid stitch because fuck you, that's what I want to charge, right? And and there's no corresponding model to reality on that, right? Where you're looking at that like liquid stitch, a month's pay, 2 months pay, like what? And they're looking at you like, well, I want to buy my kid another yacht, man. That's what I got into healthcare for. See? Oh, we all got to get ahead, right? We all got to do what we got to do to be an evil, selfish shit. So, to continue with the article, which provide opportunities either for lower prices or for investment in higher quality or more attractive facilities, both of which may worsen the competitive position of nonprofits, making it harder to cross-subsidize. It's the same concept, where they can choose what to charge for what procedures, and they can basically grow their business by charging too much for stuff like a liquid stitch. And because they're not regulated, that's how they grow their business. It's like, well, tough shit. You want a liquid stitch elsewhere, you got to go downtown to the nonprofit. And they sort of gentrify healthcare that way and create a tiered model based on who can pay and where. They've gerrymandered healthcare. And if you're the kind of person that would argue that they have the right, and now we're getting into the territory of like, we shouldn't stop people with physical violence from being awful. And I agree with you on that. But it doesn't change that they're awful, selfish, shitty pieces of human trash, right? Speaking of which, that was a garbage truck that just went by me. That was nice. Anyway, so it doesn't change, and I'm not going to evoke Martin Shkreli. I'm really going to try hard not to here, but I can see why in a for-profit system he would sit there and go, well, do I want to appease my investors or do I want to save people's lives? And that decision wouldn't be there in a well-regulated model. And it's the same reason that Amazon isn't the post office yet.